Lymphatic organs and tissues are classified into two groups based on their function. Primary lymphatic organs are the sites where stem cells divide and become immunocompetent, or capable of mounting an immune response. The primary lymphatic organs are the red bone marrow, so in the flat bones and in the epiphyses of the long bones of adults, and the second primary lymphatic organ is the thymus. The thymus is a bilobed organ located in the mediastinum. Remember, the mediastinum is between the sternum and the aorta area between the lungs. Okay, so that area where the heart is located. Immature T cells migrate from the bone marrow, where those cells are made, to the cortex of the thymus. They proliferate and begin to mature in the thymus. So the thymus has specialized epithelial cells in its cortex, or outer layer, that help to educate these immature T cells in a process known as positive selection. They also produce thymic hormones, thymosins and thymopoietins, that are thought to aid in the maturation of the T cells. The thymus is largest in the infant. It has a weight or a mass of about 70 grams, or as we more commonly think of it, 2.3 ounces. But by the time a person reaches maturity, the functional part of the thymus has reduced considerably. And in old age, the functional part of the thymus may weigh only about 3 grams, or 0.1 ounce. Before the thymus atrophies, it populates some of the secondary lymphatic tissues and organs with functional mature T cells. The thymus is surrounded by a capsule, as we've seen with many other organs and will continue to see. Some of the structures that are a part of the secondary lymphatic system have a capsule covering, and some don't. So the secondary lymphatic organs and tissues are the places where most immune responses occur. They include lymph nodes, the spleen, and lymphatic nodules, sometimes called lymphatic follicles. The thymus, the lymph nodes, and the spleen are all considered organs because they're surrounded by a connective tissue capsule. The lymphatic nodules, or lymphatic follicles, are not considered organs because they lack a capsule. So we'll begin by looking at the structure of lymph nodes. So lymph nodes are located along those lymphatic vessels, and there's about 600 sort of little small bean-shaped lymph nodes located throughout the body. They're scattered throughout the body. Some of them are superficial, some of them are deep. They usually occur in groups. Large groups of lymph nodes are present in the mammary glands, but also in the axillary region and the groin. Lymph nodes are about 1 to 25 millimeters long, or 0.04 to 1 inch long. Lymph nodes function as a filter. So as lymph enters one end of a lymph node through afferent vessels, remember A for admit, so you see there are a lot of afferent vessels coming in. So as the fluid comes in through one end of that lymph node, foreign substances, microbes, cellular debris, waste products get trapped by all the reticular fibers that are within the lymph node. Also within the lymph node, there are macrophages that destroy some of these foreign substances by phagocytosis. And there's lots of lymphocytes, which destroy other foreign substances by immune responses. So the filtered fluid then leaves the other side of the lymph node. But remember, there are lots of afferent admitting vessels coming in, but only 2 efferent or efferent vessels coming out. So that means that the fluid gets backed up or slowed as it is coming in, because there's more coming in than can go out at one time. So this slowing of the flow allows more time for the lymph to be filtered across all of those reticular fibers, and more time for the macrophages and the lymphocytes to clean it up. All lymph flows through a lot of lymph nodes on its path through those lymph vessels, before it gets returned to the blood. So this allows that blood to be, or that fluid to be filtered multiple times, each time getting a little bit cleaner and a little bit cleaner before it's restored into circulation. So just a brief little summary of lymph nodes. They're clustered along the vessels that filter the lymph. Large clusters are found in the inguinal, axillary, and cervical areas. Your lymph nodes work to filter the lymph. Lots and lots of reticular fibers making sort of an obstacle course where foreign substances get trapped. Macrophages eating away or phagocytizing foreign debris. And then the immune system activation comes into play where those lymphocytes encounter those foreign antigens or proteins on those cells, bacterial cells especially, or viral cells, which viral cell shouldn't even be a term, but it is. Virus particles is more correct. But any of those can activate the lymphocytes, and once they do, they mount an immune response, which we'll consider in much more detail. When there's an infection or a disease in the body, the lymph nodes may become overwhelmed in their filtration job, right? So if there's a lot of stuff in the lymph, the fluid to be filtered out, more and more and more immune system cells and macrophages are going to be called in or made to help clean that fluid up. So when those lymph nodes become overwhelmed, they can enlarge and become very inflamed and tender. They swell, as you can see here and here in the cervical region and in the inguinal region. That swelling can happen because of an infection, and the lymph nodes are trying to trap that bacteria. And by doing so, they sort of get backed up and cause that tender, achy swelling. You may have had before, say you have an infection because you stepped on something and you didn't treat your wound properly, and you ended up with a bacterial infection in your foot. And a few days later, you may have noticed a very tender, touchy spot there in your groin. That could have very well been a buboes. A bubo is that swollen lymph node that's caused because of an infection. However, there are sometimes that those swollen lymph nodes are related to something much more serious. Metastasis is the spread of disease from one part of the body to another, and it can occur through the lymphatic vessels. Remember, the lymphatic vessels are picking up interstitial fluid, and it's flowing throughout the body from one area to another through those vessels and through those nodes. All malignant tumors eventually metastasize or spread. Cancer cells can travel through the blood or through the lymph, and when it does, it can establish new tumors wherever they lodge. So if the lymph nodes are filtering the fluid and some of those cancerous cells lodge in the lymphatic vessels or in the nodes, then a secondary tumor is going to develop. So because the pathway of these vessels is very obviously the same in most people, that fluid is going to flow from one area of the body to another in its pathway back to the cardiovascular system. This can be used to predict the direction of the flow from the primary tumor site and a possible location where secondary tumors could start to develop. Cancerous lymph nodes, very much unlike what you have with a bubo, are going to feel enlarged but firm, not squishy. They're not tender and sore. They're usually fixed to underlying structures so they don't move around as much. Lymph nodes that are enlarged due to the infection, softer, much more tender and touchy, and movable. The spleen is the largest mass of lymphoid tissue in the body. It's soft and encapsulated, so it's an organ. Varies in size, but on average it fits in the hand, so in the open hand, usually about 12 centimeters or 5 inches in length. It's located on the left hypochondriac region between the stomach and the diaphragm. You didn't think I was going to let you forget all that terminology, did you? Remember what hypochondriac means? Hypo, under, chondri, cartilage. So this is the area under the left side of the ribs. The spleen is made up of white pulp, consisting mostly of lymphocytes and macrophages, and red pulp, which consists of a lot of blood-filled venous sinuses, which are like enlarged veins and spaces, and cords of splenic tissue. The splenic tissue consists of a high number of red blood cells, macrophages, lymphocytes, plasma cells, and granulocytes. So lots of immune cells in there. Blood flowing into the spleen through the splenic artery is going to come in contact with B cells and T cells that carry out the immune function. So the spleen is going to filter the blood, but it does so using immune system cells. So macrophages destroy pathogens by phagocytosis. In the red pulp, the spleen performs 3 blood-related functions: removes ruptured and worn out or defective red blood cells and platelets, stores platelets, and produces red blood cells, remember that's hematopoiesis, during fetal life. The spleen is the organ that's usually, or the most damaged organ in case of abdominal trauma. Severe blows to the chest on the left side or the superior abdomen can fracture the protecting ribs. Those ribs, of course, then can rupture the spleen. This can cause significant hemorrhage and vascular shock. Removal of the spleen is called a splenectomy, and it's needed to prevent death due to bleeding if the spleen is ruptured. Other structures, the red bone marrow and the liver, can take over some of the functions that the spleen would normally do. Immune functions, however, though, are going to decrease once the spleen is removed. The spleen's absence also places the patient at a very much higher risk for sepsis or blood infection due to the loss of the filtering and phagocytic functions that the spleen would normally perform. So to reduce the risk of sepsis, patients who have undergone a splenectomy often have to take preventative antibiotics before having any type of invasive procedure. Depending on the extent of damage, a splenectomy may not be performed on children because it has been found that if the spleen is not severely damaged, it does heal itself and regenerate in children. And of course, the younger the child when the injury occurs, the more likely that tissue is to repair itself. Now we'll look briefly at lymphatic nodules, also called, remember, lymphatic follicles. These are usually egg-shaped masses of lymphatic tissue that are not surrounded by a capsule, so we don't consider them an organ. They're scattered throughout the connective tissue of mucous membranes that line the gastrointestinal, urinary, and reproductive tracts, and also the respiratory airways. Because of where these are located, remember, in the lining of the mucous membranes, they're sometimes referred to as mucosa-associated lymphatic tissue, or MALT. There are many lymphatic nodules that are small and solitary, so just one little nodule all by itself. But in other areas, you have large aggregations of these lymphatic nodules. One area where we have these lymphatic nodules aggregated are in the tonsils that are in the pharyngeal region, and also aggregations called Peyer's patches in the ileum of the small intestine. The aggregations of lymphatic nodules that occur in the pharynx are called tonsils, and we usually have 5 of those, and they form a ring at the junction of the oral cavity and the oropharynx. Remember, pharynx is what we commonly call the throat, and also at the junction of the nasal cavity and the nasopharynx. So these tonsils are strategically located to participate in the immune response against things that we inhale or ingest. So we breathe in air, it's not necessarily clean. We have tonsils called pharyngeal tonsils or adenoids in the posterior wall of the nasopharynx. We have 2 palatine tonsils that lie at the posterior region of the oral cavity, so one on each side. There are also lingual tonsils that are on the base of the tongue. So it's usually the palatine tonsils that become infected and are removed during a tonsillectomy. However, sometimes the lingual tonsils will be removed as well. So a tonsillitis is when there is an infection or an inflammation of the tonsils. It's usually called by a virus, but it can be caused by the same bacteria that causes strep throat. So the principal symptoms of tonsillitis: sore throat. However, you can have fever, swollen lymph nodes, difficulty in swallowing, headache, nasal congestion. Tonsillitis of viral origin usually resolves itself on its own, but bacterial tonsillitis is typically needs an antibiotic in order to be treated fully. Tonsillectomy, or incision to remove the tonsils, can be done for individuals who don't respond well to antibiotic treatments, or to children or even young adults that have repetitive bouts of tonsillitis. So if these last for more than 3 months, even though you've been taking the medication, or they lead to obstructed airways with difficulty in swallowing and talking, then a tonsillectomy may be performed so that you can try to restore normal function of that area. Before we move into the functions of the immune system and get a little bit deeper, let's look at some clinical disorders associated with the immune system. So elephantiasis is a tropical disease where the lymphatic system gets clogged with parasitic worms. So in the lymph nodes, these parasitic worms get trapped, and in the nodes they start dividing, reproducing, making more and more and more and more of those parasitic worms. So that can lead to swelling within the tissues of enormous proportion. So this doesn't just happen in the lymphatic system. It can happen in the cardiovascular system and also the tissues surrounding these lymph nodes, or the lymphatic tissues. But the swelling, of course, is going to be due to this clogging of the vessels, but also due to the replication of the parasites within the vessels and the nodes. Also want to look briefly at lymphomas. So a lymphoma, lymph, fluid, oma, tumor, are cancers of the lymphatic organs, especially the lymph nodes. Most have no known cause. The two main types of lymphoma are Hodgkin disease and non-Hodgkin lymphoma. So Hodgkin's disease is characterized by painless or non-tender enlargement of one or more lymph nodes, most commonly in the neck, the chest, or the axillary area. If the disease metastasizes from these sites, fever, night sweats, bone pain, weight loss may all occur. Hodgkin's disease primarily affects individuals between the ages of 18 and 35, or those over 60, and it is more common in males. However, if diagnosed early, it has a 90 to 95% cure rate. Non-Hodgkin lymphoma is much more common than Hodgkin's disease, and it occurs in all age groups, with the incidence increasing with age to a maximum between about the ages of 45 and 70. So it's very uncommon for anyone to develop this over the age of 70. Non-Hodgkin lymphoma may start the same way as Hodgkin's disease, but it also may include enlarged spleen, anemia, and general malaise or tiredness and just not feeling well. Up to about half of all individuals that develop non-Hodgkin lymphoma are cured or survive for a lengthy period. Treatments for both Hodgkin's disease and non-Hodgkin's lymphoma include radiation and chemotherapy and bone marrow transplants. So the last thing I wanted to bring up here is the term sentinel node. So a sentinel node is the first node that receives lymph drainage from a suspected area that has cancer. So the sentinel nodes are usually where biopsies are performed to determine if the cancer has metastasized into the lymphatic tissue, and then of course has the ability to spread throughout the body. We'll end this video with a couple of questions for you. Which of the following filter lymph? Lymph nodes? Sounds pretty good. Lymphatic vessels? Spleen? Let's check and see. What was your answer? Lymph nodes filter. Lymphatic vessels transport. The spleen filters the blood. Filtered lymph is returned to the blood at the, bam, I already pulled the answer up on that one. You knew that was subclavian veins. All right, next we'll begin a more in-depth discussion of the immune system.